Hi everyone, in this video I'm going to take my IV insertion short video, which you can see here, and slow it down a little bit and explain the process a bit more. In this channel, I talk about all aspects of nursing. If you're interested in learning more about what it is like to be being a registered nurse, consider subscribing. I also would appreciate it if you would give the video a thumbs up if it has brought you any value. Lastly, be sure to check out the description box where I have links to free ebooks I've created and some interesting products for nurses or nursing students. With that being said, let's get on with today's video. Before you insert an IV, you want to think about where you want to place the IV. If you're trying to get an IV in for someone that's going for a CT, there may be hospital policies that you want to follow regarding the size and the location of the catheter you need to place for contrast dye. In general, our hospital policy suggests inserting an IV in the forearm as the ideal place, as it is the most safe place and less likely for the line to get kinked and not run your medication, have the IV pump yell at you, etc. Depending on the patient, you want to choose a catheter that is appropriate. If the person looks very muscular, they'll probably have good veins. But if they are elderly and are small, veins will most likely be small. So always look at the patient and identify an appropriate size. Typically, the size of choice is either a 22 gauge or sometimes a 20 gauge. So the tourniquet is tied around the patient's arm above the area where you want to insert. The tourniquet is important to be tied down quite tightly, as it will allow you to see the vein easier and have it tied in a way that you're able to quick release it once you're finished. Pay attention to the technique that is used here. You can see it is tied where there's a loop here and there's a quick release here. So if we pull on the quick release, it will untie very quickly. It is also important to not tie the tourniquet down so tightly that you will prevent arterial blood flow. You want to tie it enough to slow venous blood flow so that the veins are more plump and easier to puncture. After tying the tourniquet, make sure you place the hand in a way that allows you to visualize the vein properly. That may require you to set up or turn on extra lighting. Also, while the tourniquet is tied in place, allowing a few seconds to pass is ideal for allowing venous blood flow to slow down. After some time has passed and you feel you have a good visualization of the vein, clean the vein with whatever your hospital policy recommends to clean with. Cleaning over the site like so will allow the vein to pop more as well. Some people will also use a few fingers and tap on the vein to make it pop more. So now let's talk about the vein a bit more. As you can see, this is the ideal vein to choose from due to many reasons. The first being is that it's very straight. It looks big in size, and the 22 gauge that was chosen here seems like it will be an easy insertion. The insertion site, as you will see, will be somewhere on this line here. This is because the vein is straight here, allowing for the plastic filament that is going to be inside the vein to easily go inside the vein. The areas we would avoid inserting the IV would be these ones. The reason being that these are likely to have valves and junctions, and also the plastic filament may push the fluids in the wrong direction if it is not properly situated. So the ideal location is where you have a straight vein like this, and as you can see that this one's very straight. After the green line area, underneath is not ideal, as the vein will likely be occluded if the person bends their wrist. Alright, so now that we've decided what vein to use, we want to ensure that everything is prepared before the insert. So we flush the syringe hub so that once the IV is in, we can flush it and make sure it is patent really quick. You can also place the syringe hub in the end before, but I prefer to do it this way. Next, we want to open the back of the needle portion to make sure that it is not super stiff when we want to pull back when we're in the vein. Once that is all done, now it's time to puncture. Before puncturing, you can see that I hold the hand firmly tight and pull on the vein to make sure the vein doesn't roll when inserting. All right, so you go ahead with the puncture site and you can see that the needle goes in a few millimeters before we see flashback. As soon as we get the flashback, we know we're in the vein. Once you're in the vein, you have to be very careful with movements and try to insert the catheter a little bit further in, and then you can start pulling back on the needle catheter in the back. This is because we don't want to have the plastic filament be kinked before inserting. However, this does not mean you have to start the whole process over. If you have a plastic filament kink, you don't necessarily need to change the whole catheter. You can try repositioning it and trying to fix it, push it forward, and then seeing if that works. If there's a lot of resistance when pushing forward, that means you either have hit a valve or the vein is just not in the right, or the filament is just not in the right place. Okay, so once the needle at the back is completely out, you should see the line being flushed with blood. This is a good sign, meaning that you are in the vein. Try and hold the hub like so, and ideally you would want to have the dressing ready to be put on. In this case, we did not do that because I was alert and orientated ×4 and did not move my arm. As many of you know, that is not always the case. Moving on to the dressing site, you want to ideally be able to visualize the insertion site to see if you see any redness around the area. If it is red, that could be indicative of phlebitis, and you may want to consider taking it out. Remember that potassium solutions are very hard on the vein, so you have to administer these at a slow rate. We also want to flush with some normal saline to ensure that the catheter is patent. Next, we want to make sure that we secure the syringe hub with extra tape so the IV site doesn't get dislodged easily and doesn't kink the line. Then you're done. The IV is in, it is secured in place with the dressing tape, and the line is patent and ready for use. I also think it is worth mentioning to know the patient's history before insertion. Things like chemotherapy can make veins more sensitive and lead to difficult IV starts. Also, be careful with patients on blood thinners because the line might seem to have gotten a flashback, but in reality, you are actually not in the right place. To combat this, we want to pick a healthy vein to catheter size ratio. Look at the vein that may be easy to insert for a 20 gauge, but place a 22 gauge in it. Alright, so that's the end of this video. I hope that it was helpful. If you've learned something, please consider giving the video a thumbs up and let me know in the comments below if you have any other suggestions you have for me or other nurses watching this. Thanks for watching, and I will see you in the next video.